The President recognizes Senator Lucido.
Thank you, Mr. President. I rise today to speak in support of Senate Bill 956, and I request that all my remarks be printed in today's journal.
Without objection, so ordered.
This bill is for the benefit of those who cannot be admitted into a hospital. These are the ones that don't meet the threshold for a hospital. Those individuals, this bill is aimed to protect. It's both in nursing homes, we want to protect them too, and we want to save lives. I wish they could speak for themselves. Then they wouldn't need a legislator to speak for them here on the Senate floor. I truly wish that their families could do the speaking for them, but unfortunately, they're barred from even visiting them face to face in a nursing home. So our job today is to go ahead and do what we need to do as legislators and be proactive to a policy that has failed. First of all, from the earliest days of this pandemic, we learned about the virus and the effects on the elderly. Nobody can deny that. Even before our governor issued the executive order to put COVID-19 patients in the nursing homes facilities, there was objections and warnings that were clearly made by all of us in here, especially the Healthcare Association of Michigan, which represents over 350 nursing homes and rehabilitation facilities in the state. If I'm going to take advice from somebody, I'm going to take advice from the people that actually are doing the jobs for those with boots on the ground in the nursing homes. Those are the individuals I care about. So HCAM sent a letter to our governor and her esteemed healthcare team on March 13th, clearly asking the governor to specifically locate COVID-19 positive nursing home patients in vacant or new facilities to prevent the spread of the virus in existing facilities. That advice should have been taken by our governor and her entire team. But the governor ignored the recommendations of the nursing home professionals and issued her executive orders anyway. Now, for some yet unknown reason, state officials made these decisions to bring COVID-19 patients into the facilities with disastrous results. I don't even know how to begin to tell you that as you consider the escalation of the numbers, no one took the time to say, stop, enough, cease, desist. No, that didn't happen, but it happened in other states. They stopped it. Despite the inherent risk to the elderly population, the state gave these facilities an extra $5,000 for each approved bed and made available for COVID-19 patients as well as $200 per day for any of the occupied beds. We gave incentives. This was on top of the additional funding that the hubs received for patient care. Then on top of that, we gave immunity from COVID-19 related lawsuits. I don't understand how these orders, because I don't see any science and data that can correct this. Despite the risk to health and life, the state of Michigan went even further. They incentivized bringing COVID patients into nursing homes. They sweetened the deal. Well, what happened? More than 1/3 of the Michigan COVID-19 related deaths occurred at the nursing homes. And to date, I really don't even know if that's the number because we weren't provided with any science or data on those numbers. You know, the elderly are the most vulnerable people. And in the nursing homes, they go because they need to be nursed, to care, to be taken care of. By the state's own admission, that's exactly what happened. The deaths were caused as a result of the spread of COVID. Read the news. You'll hear the stories of so many families who have lost vulnerable elderly loved ones because of the governor's decision and apathy. We also heard similar stories from families during the committee testimony on this bill. I can tell you this, as of today, I'm still appalled that this has happened.
Thank you, Senator. Time's expired.